Hey you guys, it's Emily, and today I want to talk to you about evidence-based medicine, what it means and what it doesn't mean, so you can just be more informed and better able to advocate for yourself in the healthcare industry. So evidence-based medicine has three equally weighted parts. The first is the scientific literature. So that's often what we hear the most about. It's research studies that are being conducted to evaluate the effectiveness of different interventions. The second is clinical evidence. So this is the observation of your clinician based off of implementing interventions to, whatever the problem is over and over again with different people and observing the outcome. So it's like, if you have knee pain, I do this, what's the outcome? And you repeat it person after person and evaluate the effectiveness based off of that evidence. And the third is the patient, your subjective experience and your preferences. So that's, do I like the intervention? Am I able to stick with it? You could have the best treatment in the world, but if the patient's not able to stick to the treatment plan, it's not useful at all. So it's your subjective experience. Do you like it? Are you able to stick with it? Do you feel better? So those three categories are equally important when it comes to evidence-based medicine as a whole. Unfortunately, we put a lot of emphasis on the scientific literature and less on clinical evidence and patients' experience, and I think that's a mistake, and I'll tell you a few reasons why. So when it comes to scientific literature, just because something's been researched doesn't mean that research was high quality, and it doesn't mean that there wasn't bias in the medical research. So when it comes to high quality research, this is kind of what I mean. The most famous story is this study about statins, or cholesterol lowering medication, that came out I think in the 90s. And the headline was that statins lower your risk of heart attack by 50%. Sounds really great, right? But that is the relative risk in reduction. In reality, if you had 2 in 100 chance of having a heart attack, that statin drug lowered it to 1 in 100 chance. So the absolute reduction in risk was 1%, whereas the relative reduction in risk was 50%, and that doesn't take into account the risks associated with statin use. So you can see, based off of the way that the statistics were manipulated in that situation, that you have to be really literate in reading medical research to kind of gauge whether the quality of the research is good and whether the headline or the title of the paper is actually what they looked at in the research study and that it's accurate. So just because there's studies on something doesn't mean those studies were good, doesn't mean they weren't affected by bias, and I'll link an article about medical bias down below so you guys can just be aware of what's going on in that industry. And secondly, just because there's not research on something doesn't mean it's not true. It could mean that nobody's thought to ask the question. It could mean that they couldn't get funding for that study. It could mean that it wasn't ethical or practical to study that intervention. We see that a lot in maternity care. It's not always ethical to intervene in a pregnancy, so our prenatal studies are often observation-based, and so there's no control. So there tend to not be high-quality studies about prenatal care. So just because there's research about something doesn't necessarily make it true. Research is constantly evolving, so you kind of have to use your critical thinking skills and engage some skepticism when it comes to scientific research. So when it comes to advocating for your own healthcare, the best thing you can do is use your intuition and work with a provider that you trust, who stays up to date on both the scientific literature, the clinical evidence, and takes into account your preference. If you like the treatment, if you feel better, if you're able to stick to the treatment plan, and if you're not, they tweak things to make it easier for you to follow. All right, so I hope that's helpful for you. That's kind of my breakdown about evidence-based medicine, what it is and what it isn't. Hopefully you made it through this video with me. It was a little bit on the longer side, but I think it's really important for us to be educated and good advocates for ourselves in the medical industry, especially in this insurance-based system that we have in the United States. All right, thanks guys.